The following is a paid advertisement of St. Anthony Hospital Orthopedics. References to any specific product, services, or entity does not constitute an endorsement or recommendation by St. Anthony Hospital, Carroll Broadcasting, or its advertisers. The views expressed by the host or guests are their own, and their appearance on the program does not imply an endorsement of them or any entity they represent. Welcome to the St. Anthony Hospital Orthopedic Show with Dr. Richard Godding. Dr. Godding specializes in joint preservation, reconstruction, and replacement surgery, and brings over 25 years of orthopedic excellence to St. Anthony Hospital and to the Carroll area. For more information about Dr. Godding, his practice, or St. Anthony Orthopedics, go to santanthonyhospital.org or make an appointment by calling 712-794-5536.
Good Sunday morning, Iowa. It's Dr. Rick Godding here. Thank you once again for spending some time with me here during this holiday season. It's been a little unseasonably warm, but I'm sure that'll get taken care of with some blisteringly cold Arctic blasts before we know it. But it's definitely fireplace time. I have a wood fireplace that I really enjoy. And love to sit there with my dogs and just relax and read a book or just sit and look at the fire. It is the one thing about this time of year that I actually enjoy is sitting inside by the fire. Other than that, there's not a lot that I do enjoy this time of year as far as the weather goes. I used to ski and snowboard when I was younger. My kids go, and I've been a couple times recently, but last time I went, I fell so hard snowboarding that I decided I would never snowboard again because I just felt like I was right on the brink of a real injury. And skiing, I skied when I was little. I mean, I used to race, and I just skied essentially like the first 30 years of my life a lot. And so, but I also think that when you're skiing, it's more easy to soften your fall because your feet aren't clamped together on that board. Once you go past the angle on a snowboard by which you're going to fall, there's no recovery and there's no adjustment. You're just down. Whereas with the skis, you can kind of ease into the fall. So I don't know. I might ski this year with my kids a couple times. I might just go watch them from the lodge. They go up to Seven Oaks here in Boone, and they enjoy it. It's a nice little hill for kids, to go skiing on, and looks a lot bigger when you're smaller, I guess. But yeah, that time of year, and lights are up. Everybody's getting their Christmas lights up. Ours are not quite up. I have my wreath up. I don't have my lights up. I mean, I was just in the last weekend, I was in the yard doing leaves for basically the whole weekend because my yard gets a ton of leaves. So we had a group from the school that was fundraising, and they came over, and we spent most of the day on Saturday, and then I spent most of the day on Friday and half the day in the afternoon on Thursday. So it was a little bit of a heavy work burden over the weekend. And I have to say, I really, carrying that backpack blower up and down the hill in my backyard and hauling leaves and moving my shredder and all that stuff, boy, you really get a new respect. Now, I work out, 3 to 5 times a week. I mean, I do sprints, I do weightlifting, I do kettlebells and all kinds of stuff. And let me tell you, that took it out of me. Those guys and gals that are working all day, every day, man, it's hard work. There's a lot of hard work being done out there. And thank you, those of you who are doing that hard work on the day-to-day, because it is clearly very, very tough. But it's kind of fun to be out there, too, and be doing stuff. Obviously my profession is indoors, so I like to get outdoors on the weekends when I can. And, so I wanted to talk a little bit about, I don't really talk much about feet and ankles because I really don't do much in the foot and ankle. Now, I did a fellowship in foot and ankle surgery, and I only did that because I had some time between the time that I graduated from my residency program and I started my shoulder and knee fellowship. And I said, well, I was going to Australia to do my fellowship. So I said, well, I'll just fill that time by doing a fellowship in foot and ankle surgery really just so I wouldn't be kind of sitting there doing nothing for 6 months. And it was a great experience. I was in Sydney, which is an absolutely gorgeous city. I was with the two top foot and ankle guys in Sydney, and I learned a whole lot. But I don't really use it because my focus is on shoulder and knee surgery. That's what I did my other fellowship in, and that's what, I've dedicated my 20-year career to, really pushing my skill set and my knowledge base on shoulder and knee surgery. And so that's why, I can do a lot of very advanced shoulder and knee surgeries, and I don't really do anything elective in the foot. When I say elective, so there's emergency cases and urgent cases, and those are like, if you break your femur or something like that, that's an emergency. Urgent case is you broke your wrist, we got to get it done within a week. And then there's elective cases. So in the foot and ankle, I don't do any elective cases. If you broke your ankle and I happened to be on call when you came into the ER, I would fix it. Or if you broke some of the bones in the foot, but not others. There are certain foot bones that I'm not going to tackle because, for instance, the talus bone, which supports the whole ankle, when that breaks, it's something that someone who is doing those all the time ought to be doing, so I don't do those. And as far as elective cases, I don't do any elective cases in the foot and ankle. But I want to talk a little bit about foot and ankle health because, hey, it is in the purview of orthopedic surgery. There are orthopedic surgeons who are foot and ankle specialists. Podiatrists are not orthopedic surgeons. They're different. Instead of going to medical school, they go to podiatry school. And then after that, they do a residency. And there's a very wide variance in what podiatrists will do. And it all just depends on what that doctor's training is. Whereas with an orthopedic surgeon, if they're a foot and ankle specialist, they're going to do mostly foot and ankle surgery. They're not going to do corns and calluses and things like that. And we're going to talk about that a little bit. But they will do things like bunions. And so we talk a little bit here about the difference between those things. So a callus is just that thickened skin that you get on your foot. You can get some on your heel or under your first toe or your fifth toe are the most common ones. If you have a callus under your second or third metatarsal heads, so that would be not on the bottom of your foot on the inside or the outside, but in the middle, you probably should have that checked because there is no reason that you would have a callus there as opposed to the other places. So that might be that your foot has a little bit of a deformity to it, and that deformity can be acquired over time. So that's one of the things you want to work on is if you have a callus under the middle part of the front of your foot, that's something to pay attention to and probably get looked at. Now, a bunion, people think a bunion is sort of a growth on the inside of your foot. It's not really that. What it is the metatarsals are the bones that go from the ankle essentially to the toes. So that mid part of your foot, there's some bones in the midfoot, and then you have the metatarsal bones. So they'd be the long bones that you can kind of see there at the top of your foot. And the first two can, because of just different biomechanical reasons, and one of the things that you can do to try to avoid this is wear flatter shoes. So women who wear higher heels tend to have more bunions, and so footwear can really affect that, obviously. But the first two metatarsals can widen out, and when they widen out, the toe then points in. So you have sort of, it almost looks like a chevron on the side of your foot. So your toe is pointing in, but your metatarsal is pointing out. So you have sort of this angle, and it makes it look like there's a great big growth on the side of your foot, sort of where the toe meets the metatarsal, but it's really not. You can have a callus that develops there, and you can even have some bony growth underneath there, but mostly the deformity itself in a bunion is the metatarsal and the phalanx, which is the first. So you have your tarsals, which are the bones in the ankle essentially, and then the midfoot. Then that comes to the metatarsals, and those are the long bones. And then the bones in the toes are the phalanges. Now, when you have this deformity, you can treat it with a wide toe box shoe, and you can keep your heel low, and you can manage it. But if it hurts and it's not getting better with that kind of stuff, then you need to have surgery. And what would happen is the bone will be cut and moved over and straightened. kind of a longer recovery, although some of the newer techniques allow you to bear weight a little bit sooner. But that's that. That's a bunion. And then calluses, like I said, calluses are just that thickened skin. Now, a corn is typically can be inside a callus, so it's a little bit deeper. And the corn is sort of a growth of material, and it grows up towards the surface, but it's something that needs to be removed. So the corn, it can be within a callus, but they have a hard center, and then they deep inside, there's some material in there that's a byproduct of your glands and your foot, and you have to get that out. And you shouldn't do it yourself. You should have a podiatrist do it. The impetus for me kind of talking about this is I ended up having a corn, and it was on the outside of my foot, and boy, it started to hurt so bad that I was limping, and I had never had one, and I don't see patients with these, so I kind of was not really looking for it. Plus, it'd be difficult to see your own corn because you got to take a pretty good look at the bottom of your foot. But one of my colleagues here, who's a podiatrist, took a look at it one day and he said, "Yeah, you got a corn," and he just kind of shaved it out, and I had essentially immediate relief from this pain that had been going on for months and months, maybe a year. I looked at x-rays of my foot and I said, well, there's nothing there. But it's something that definitely, if you're having pain in your foot, you should go see a podiatrist or a foot and ankle orthopedic surgeon, because they can do sometimes some minor stuff in the office that really provides you a lot of pain relief. I had essentially tremendous pain relief from that, almost complete. And then he said he might have to do it again a little bit, and it's probably getting time for that. But don't ignore that kind of stuff. Now, the other things that you can see in the foot as you get older is you can develop flat foot. Now, flat foot comes sort of, there's pediatric flat foot where you're born with it, and that's a structural problem with just how the foot is formed. And usually they don't really do much, and it usually isn't a big deal. But if you do start having pain, especially if you get older, it's called acquired flat foot. One of the reasons you can have acquired flat foot is because your posterior tibial tendon, so that's the tendons that are on the inside of your foot, can get weak or even tear. Then your heel will start pointing out, your toes will be pointing out, and the middle of your foot, where your arch is, will start contacting the ground. And that is biomechanically, which is to say, using physics to describe the mechanics of how the body works. Biomechanically, that's a very bad thing. If the middle of your foot is touching the ground or touching your shoe, that's something you really should have looked at. And I know that there's a lot of people out there that kind of, ignore things as they progress, and then you get in, and it's kind of like what I say with a shoulder. You want to get in and get that shoulder looked at. If you've had more than 2 or 3 months of pain, you want to get in and have someone take a look at it, because you can head off bigger problems at the pass. It's the same thing with the foot. If you're having pain, and especially if you notice the shape of your foot changing, you should definitely get in and see somebody. Again, your choice between a foot and ankle orthopedic surgeon or a podiatrist. And I think that if you do limp and you have a foot that doesn't look right, you probably should get in. Now, diabetics have a much bigger and much more problematic list of things that can go wrong with the foot, and that has to do with the fact that, well, there's a lot of things. The nerves in diabetics over time stop sensing the pain. You've heard of diabetic neuropathy. So neuropathy can actually be where the nerves not only aren't sensing pain, but when you step on things, but they can have sort of like a burning sensation all the time. And that's a real tough situation. It's not just diabetics that get neuropathy in their feet. A lot of people have neuropathy in their feet, and we don't have any reason to understand why. We think that a lot of people who have neuropathy in the feet have had exposure to certain chemicals, and there's all kinds of different ways that you can develop neuropathy. There are different diseases, and then, of course, there's the diabetes. And so the diabetic foot, the problem in the diabetic foot is that the foot is the farthest away from the heart. And so you're pumping the blood down there, but if you have a lot of sugar in your blood, and the sugar is creating a situation, I've talked about this before, glycation of the red blood cell, specifically the hemoglobin portion of the blood cell that is transferring the oxygen. Glycation is when sugar attaches to that and it disrupts the body's ability to give oxygen to the tissues. And so without the oxygen, the tissues kind of start to slowly die. And then if you have in diabetics, you can get severe cases, they can have gangrene and get a lot of infections. So feet are something I don't talk about much because I don't do much with them. But I do want this show to help educate people. I want people to feel like when they listen to the show, number one, obviously, I want your health to be better overall. And, I focus on diet as well sometimes, but mostly, I'm an orthopedic surgeon, and this is all in the purview of orthopedic surgery, even though it's not my specialty. But I want you to understand that if you have these issues with your foot, you should be probably seeking some treatment. And again, if you're diabetic, you want to get that under control primarily because that's going to help you with all the problems. The feet are just part of a long laundry list of things that can happen when there's too much sugar in your blood on a consistent basis. And that's sort of the hallmark of diabetes is the insulin is not able to get all the sugar out. And so then you get more and more insulin, and then you get to the point where you're not able to produce your own insulin, or you become insulin resistant. It's a complex disease. It's a difficult disease to treat. Most people in America that have diabetes have type 2, which means that it is an adult onset diabetes, and it's a combination of genetics and diet. And you can't control your genetics, but you can control your diet. And the less sugar you eat, that's just a straight up fact. The less sugar you eat, the healthier you'll be. And I understand everybody can eat a little sugar. I've actually had the tiniest little sliver of a cookie that my daughter made the other day, but would have been less than a tiny half of a spoonful. Boy, it was delicious. She made these things called Dubai chocolate, and it's got some shredded phyllo dough and some pistachios and some chocolate, and it was very tasty. So I understand. Really, I would have liked to eat the whole bar, but I just had a tiny little piece. But the less sugar you eat, the healthier you will be, just full stop. Sugar, corn syrup, sodas, cookies, candies. I know it's that time of year. I know it's tough. And sometimes people feel like, you want to, like for me, I'm going to be as rock solid as I can be on my carnivore diet through the holidays. And I did pretty well over Thanksgiving. I had the tiniest little nibble of pie and a tiniest little nibble of stuffing. But I did have some chicken gizzards at the truck stop with my grandma because I've been doing that for 40 years and she's 97 and that was just a tradition. So I went ahead and did that. But, getting through the holidays, try to be as good as you can. And don't forget, if you're going to make a New Year's Eve resolution, the time to do that is now, and start telling people in your life, hey man, January 1st, I'm going to turn over a new health leaf, and this is what I'm going to do. Find yourself a program, find yourself a diet or a supervised nutrition situation. Most hospitals will have dietitians. St. Anthony's has dietitians. You can go get with your primary care doc and ask them what they recommend, but it's not as helpful, I don't think, to just say, I'm going to eat better. You got to have a program. You didn't get into poor health. If you're talking about doing that, you're probably in poor health. You're probably overweight. And you didn't get there overnight, and you didn't get there without just probably eating the wrong kinds of things. And you need to learn how to eat the right kinds of things and then have somebody who's helping you with a program or find a program on your own. And so, yes, we're getting close to the end of the year, and here is to your health and a happy, healthy new year. So now's the time to start advertising your health transformation to those that you love so they can hound you about it and help you along the way. So with that, I'll be back next week, and you have a pleasant week, Iowa.
This has been the St. Anthony Hospital Orthopedic Show with Dr. Richard Goding. For more information about Dr. Goding, his practice, or St. Anthony Hospital Orthopedics, go to www.santanthonyhospital.org or make an appointment by calling 712-794-5536.